Only once you've communicated your vision can your vision be understood and then supported. But many health entrepreneurs fail at this first hurdle. They don't know how to communicate their vision properly so that people can get behind them. What was it about communication in healthcare that you felt was being done badly?
You have a lot of companies that all kind of blend in to look very similar. I have lost count of the number of websites that I have looked at where I have no clue what they're doing.
Healthcare companies need to be quite risk averse. You can't be making these outlandish promises. But then why do you think that then translates into the way that company communicates?
I think 2 reasons.
Why do you think it's crucial for these companies to not only define its identity, but to ensure that every action, decision, and strategy aligns with that identity?
It comes down to authenticity. Don't try and be something that you're not, because you will get found out really quickly. We're seeing some of the consequences of that now. Let's not forget the big telehealth company that claimed that its chatbot was as good as a GP.
How can a company demonstrate that they're authentic through this value-led approach?
You're going to get a better result if you figure out how you can deliver value and stop trying to sell.
How do health entrepreneurs, the ones that are pioneering for change or disrupting the status quo, have a long-lasting impact on healthcare? Well, it's all about communication, right? Only once you've communicated your vision can your vision be understood and then supported. But many health entrepreneurs fail at this first hurdle. They don't know how to communicate their vision properly so that people can get behind them. So how can you create a genuine connection with someone? Well, more often than not, it's all about building a community. But this is a craft that's misunderstood, mishandled, and often undervalued. Today, I'm joined with Jessica Smith, who's the co-founder of SomX. SomX are a communication agency that specifically understands health tech. They're an agency that helps other entrepreneurs understand their relevant audience and understand how to communicate to that audience effectively. You might know SomX because of their sellout events that they host at Google in London, or because of the Health Tech Pigeon newsletter that has over 4,000 subscribers, or because of their other co-founder, James Somaru, who is the host of the fantastic Health Tech podcast. SomX aren't just a comms agency, but what they've managed to do is actually create and cultivate a community and movement in the health tech space. My conversation with Jess today ranges from discussing the problems that there are with communication in healthcare to how SomX has managed to help other brands and companies communicate effectively to their key relevant stakeholders. So my name's Ash and I'm your host of the Health Beyond Tomorrow podcast. We aim to inspire health professionals to start thinking outside the box and to start looking towards a healthcare beyond tomorrow. We talk about all things entrepreneurship, health technology, and just the future of healthcare. If you enjoyed this episode, please make sure you hit that follow button down below, whether you're on Spotify, YouTube, or Apple Podcasts. I put in so much effort to my episodes week on week, so it will just mean the world if you just hit that follow button. It helps the channel to grow and it's free, so why not? I begin this episode by asking Jess to break down who she is, what she does, and why she is best at what she does.
Oh, straight in with the hard questions. So first of all, who am I? I am Jessica Smith. I'm co-founder of SomX. So my background is in healthcare communications. I started off my working life in the comms team of a hospital. I worked for different charities and public sector organisations, including the Royal College of Physicians, before I then moved over to the agency side where I was working with big pharma, big tech and consumer health as well. And I met James when he was doing his MLM fellowship at HE, just before he went across to digitalhealth.london and started running some of those accelerators. And it was when he was there really where we were chatting and realized that actually a huge problem for companies in the space was communication, and that really it was this red thread that ran through everything that every company did, and they didn't really understand how to get it right and why it was important. And that's where SomX kind of started. That's the first question. Remind me of these parts. There was many of them.
Who you are, and then
Yeah,
what you do. So you answered that, and then why you are best at what you do. So maybe talk a little bit about what SomX does in terms of, you're obviously a comms agency, but talk a little bit about what that means. What does communication mean in healthcare? What does it encompass? Break it down, and then talk a little bit about why you're the best health tech comms agency in the space.
This is helpful. Thank you for breaking that down for me. And I think it's going to be a tough one for me. I think if you ask James that question, he would reel off why we're the best really easily. But for me, that's a little bit more challenging. So we'll see where we get to. But who are we at SomX? So as you said, we are a communications agency. We started off as a specialist health tech communications agency. And what I realized from my experience working in big agencies was that health tech was really different to any of the kinds of companies that I had been working with and was working within that environment. And that is because when I was working with those big corporate healthcare organizations, they would often be focusing really specifically on one type of stakeholder for an extended period of time, be that 6, 8, 12 months. And in health tech, because it's a new industry, really, you don't have that benefit of only being able to talk to one particular type of person for any period of time. In any given day, you're talking to investors, you're talking to collaborators, you're talking to users, you're talking to payers, you're talking to members of your team. And you have to be able to have a solid foundation of communication that sits underneath all of that. But you have to be able to communicate very specifically the value that you give to each one of those stakeholders as well. I found increasingly as I was in that agency space that I was being brought into projects and programs and working with clients who required like a full ecosystem perspective. And most people in agencies either are, if you're working in health, you're either very focused on pharma or you're very focused on consumer health. And that in itself isn't a niche. So you don't necessarily have that kind of zoomed out perspective. And then adding into the mix James's perspective as a clinical doctor, having worked in policy, having also then worked with the BMJ, running a podcast, writing for forwards and that, all of those kinds of things. Together, we just had this really unique vantage point where we really understood each of the different groups of people within that spectrum and what it was that they needed and their problems that they needed solving. And so I think that's where we saw our niche. As I said, we recognized that these companies needed like a solid underpinning communications framework, but they also then needed to be able to use that to actually talk about what they were doing. That's what we do, I guess, across the strategy, as I've talked about, and then delivering that strategy across multimedia content, press and PR, and then also in creative and design as well.
Yeah.
So we are an integrated one-stop shop for all of your healthcare communications needs.
What was it about communication in healthcare that you felt was being done badly? And what was the need? Why is there a need for a comms agency and specifically the health tech space to come in and basically identify that, you know what, companies aren't very good at communicating to their audience or to their target demographics? What was it about specifically that made you and James feel that this could be done better?
As an industry, we're quite risk averse, and I think healthcare is a sensitive space. You are dealing with life and death. People's lives are on the line, and the consequences of not getting things right, and I don't necessarily mean this about communication, but the consequences are, the stakes are so much higher. They have real life consequences, and overclaiming in another industry would be okay, but it's not okay in healthcare. You can perhaps claim that, I don't know, an eyeshadow will make your eyes look more blue than any other eyeshadow on the market, but you can't just start telling people that you're going to save lives and cure cancer. You have to be able to have evidence to back that up, and the level of evidence that is required to be able to back those statements up is really significant. So people won't just, it can't be ambiguous, it can't be tenuous, there has to be solid evidence. But I think often what that does is create an environment that people not quite sense themselves, but they filter themselves. And then I think what that means is that you have a lot of companies that all kind of blend in to look very similar. So we laugh and joke about the classic blue branding, but it's true. It's a cliche for a reason, and also very non-committal language. I have lost count of the number of websites that I have looked at where I have no clue what they're doing and who they're doing it for, because they don't have a clear value proposition and they don't know who it is really that they're talking to. Or maybe they do, but they haven't understood what that audience needs.
Why? So we've obviously mentioned that obviously healthcare companies, health tech companies need to be quite risk averse. You can't be making these outlandish promises. But then why do you think that then translates into the personality of the company, the branding of the company, the way that company communicates?
I think 2 reasons. I think often they don't have particularly big budgets to work with big creative branding agencies. And I think often there's a misconception that you need to have that in order to create a brand. And I also think that it is just playing it safe. And I think the other side of that is that let's not forget it, particularly in healthcare and in health tech, it is full of really incredible experts who have clinical backgrounds, they have academic backgrounds. They are not masters at communication, and they communicate in a very specific way. They're very direct. There's no flowery language. Tone of voice is not a concept that they necessarily have heard of, and why should they? Much less should they understand it. And so I think in part it's that. It's a very tricky time at the moment because, by contrast to pharma, there's very clear and specific rules and regulations about what you can say and what you can't say. At the moment in health tech and in med tech, that is less clear. Those guidance haven't yet been put together. And so it's much more ambiguous and it's more self-policing. And I think that is probably the biggest difference, I would say, because in pharma, if you get it wrong, there are huge fines to pay. There are less consequences on the health tech side. And so I would say the majority of what we see is people who are playing it safe, but you do have the outliers. Let's not forget the big telehealth company that claimed that its chatbot was as good as a GP. There was no evidence to back that up, and that faced a lot of criticism. But there were no fines or anything that you would get perhaps from the ABPI in pharma. That was community policing, and those claims have to then be pulled back.
Yeah.
So I think it's a mixture of things, but I think health tech presents an opportunity to be more progressive than we perhaps have been before in healthcare.
Yeah, maybe not that regulatory policing like you do have in pharma, but as you mentioned, that telehealth medicine company did have to retract their statements because it became clear that their promises were somewhat exaggerated or false.
Yeah.
But yeah, it's interesting. We spoke about this last time, so I apologize for repeating myself. We spoke about institutional academics and how they often lack a distinct personality, but that's not to say they necessarily need it in the world of academia where everything is very fact driven. It is, as you said, blue branding, black and white. It's often sterile, very fact driven, fact of the matter. And in a world that's dominated by branding, this can be seen as a disadvantage because you're not catching the specific demographic, the specific target audience's attention. And so my question is, those academics that leave medicine and now need to do a reset of their thinking when they're starting their company, whether it is in health tech or whatever type of entrepreneurial pursuit, how do they do that reset of thinking and look at branding, marketing differently to what has traditionally been taught in institutions?
It's a really good question. And what I would also clarify is that the academics don't lack personality, but I think they communicate in a very specific way that could be it's not fluffy, and it isn't going to be interesting or exciting to the vast majority of people, because by and large, actually, even from a technical perspective, it's way beyond anybody else's understanding. So my first piece of advice would be to think about how to communicate as simply as possible. I think that's one of the biggest barriers, is the complexity of language. And I had a really great conversation with a founder the other day who is actually a doctor too, and his startup is very focused around communication with patients and patient information. And he said so perfectly that in the clinical world, we communicate in code. We are using a code that is not understood by the rest of the world, and we then don't understand why patients can't grasp what it is that we're saying, and we almost use that to gatekeep from patients. But actually what we've realized is actually informed patients are going to have a better outcome, and they're going to be easier to manage as well. And I think that really perfectly illustrated to me that the power of just simplifying the way that you communicate, and never be concerned about oversimplification, because I think, generally speaking, when you're a technical or a clinical expert, what might feel oversimplistic to you is probably just about right for most people. So it's understanding that not everyone has the expertise that you do. And I've worked, as I said, in healthcare, I've worked in the police, two of the most acronym heavy, jargon heavy spaces. And And those acronyms change all the time. And in the industry, we can't keep up with them. So we can't expect other people to. So I think it's that. And I think the other part is the facts, the data, the evidence is really critically important. And no one is ever suggesting that should be ignored. That should actually be really fundamental to the way that you communicate, because ultimately what it does is back up everything that you've said. And that builds trust and credibility. You never want to be in a position where you're telling people we're trusted or we're credible. That's a sense or a sentiment that you want people to feel or associate with you and your brand. And the other part is that an organization has a personality, but that personality is not you as an individual, whether you're a co-founder, whether you're a senior member of the team or a junior member of the team. And I think I would always recommend taking some time as a group, ideally, rather than as an individual, to think about the values of your organization, how you want people to feel when they engage with the organization, and what are the personality traits of that organization. And in the same way you would describe a person. And I think what that then does is give you a good framework for something that I just talked about earlier, which is tone of voice. And everyone will be familiar with tone of voice in the context of, I didn't like that tone of voice that you spoke to me with. But actually, it's really important in terms of defining interest and personality and injecting color and interest into something that you have to say. It's what draws people in and what engages people. And I think that is really useful. And then after that, you can then come to building out a core set of messaging, but you're going to be able to do it in the voice of your organization rather than your voice or someone else's voice. It's going to be more of a collective. So I think those are some of the bits of advice that I would give to someone coming out of a technical or clinical area, thinking about how do they communicate better with a wider group of people.
So what you're talking about is, obviously, it goes back to that first question I asked you, the importance of understanding and defining who you are, what you do, and why you're best at what you do. I guess from a comms agency point of view, you probably would think that's quite easy, right? And quite obvious. Whereas I struggled with the podcast and specifically branding the podcast as who I am, what I do, and why someone should listen to me, for example. So tell me a little bit about how someone can identify those values and then align those values with their company trajectory and where they want to go on.
I always suggest start with the big picture. So if you were successful in doing whatever it is that you do, what does the world look like? If you achieve everything you set out to achieve, how does the world look? So that's your vision in the simplest of terms. And I think from there, you can then ladder backwards. So your mission is, what are you doing to achieve that? And sometimes in that mission, you might want to quantify a step that you take in order to get there. So for some people, it might be like using X type of technology to change outcomes for 1 million people living with cancer. That's a very simplistic version. But some people like to quantify it that way. Some people, it's all about the technology. Some people, it's all about the people. But that's what your mission is. And I think from there, what your values, when you've, as I said before, when you sat down to think about what is it you stand for, what is it important to you as an organization, from there, that will help give you the pillars of your messaging, which will often be about, as you've rightly said, why are you the best people to be doing it? What are your creds? What is it that's the problem that you're solving? Why does that problem need to be solved? How are you solving that problem? All of those things can make up your core messaging. And if they're linked to your values, I think that is also then what translates to the brand's personality, but also the brand itself, and makes it's easier then to identify with that. And that messaging then is just a framework that can be woven through anything that you do as an organization, whether that's sending emails, whether that's team meetings, whether that's investor decks, sales pitches, standing on a stage, delivering a keynote presentation, or being part of a panel. That can then just be the framework. And one of the best pieces of advice that I was ever given was around media training. And the human brain can only retain a certain amount of information, especially when you're under pressure. And the best thing that you can do is memorize 3 things that you want to say and keep saying them over and over again, and say them in different ways. But that then is the framework for your meeting, your pitch, your presentation. But then you only have to remember those 3 things, and you'll be close much. You'll find that you're able to learn that message far more easily because you're not trying to get every single key message out there. Maybe you're focusing on the vision and why that vision is so important, but focus on fewer things, not many, and 3 at most, because you won't remember them. And then that also gives you a framework, because you want to talk about your proof points and your evidence and the data that we talked about. And you'll remember the evidence for those 3 points, but you're not going to remember the evidence for 5 or 6 or 7 of those. So it helps you tell the story.
Yeah. And focusing on those 3 things is obviously going to be difficult. A lot of health tech companies, a lot of med tech companies, they spin out of years and years of academic research or PhDs, thesis, and they are pages and pages long. So it's obviously going to be difficult for those individuals or companies to then condense the problem, what they're trying to solve, and then the vision going forward into just 3 statements. So what advice would you do to really hone down on what it is that you want to say in those 3 things?
I think use that criteria that I just talked about and try and identify what you can say on across those things. And then what you will find, and what I often find, is that I may have 6 pillars to start with, but I realize that there are 2 that has crossover, or that there's 1 message that crosses over into 2 other messages. So actually I can split that out. And I also think you can do a prioritization exercise. So which are the most important things that people need to know about you, your business, and what you can do for them. And the other thing to remember is that all of this that I've talked about so far is actually not specific to any particular audience. The real art is that actually when you think about your audiences and you develop your value propositions that are specific to them. So it's, what is it that you're doing for them? And how are you making their life easier? What problem are you solving? And that basically is translating your messaging, and it's putting that really personalized filter over the top of it. And so not every key message, don't have the expectation that every key message is going to be relevant to every person. It won't. Those key messages should encompass your company and what you're doing, but those value propositions will help you filter out which key messages are most relevant. And it could be that only 1 or 2 is relevant, and that's also okay. But when you identify which key messages are relevant, that helps you build your value proposition.
That's a great answer. And I thought of this next question, having read the book Atomic Habits by James Clear. And he emphasizes the importance of obviously implementing good habits, but the only way you can implement these good habits is by first aligning these habits with an identity that you see yourself becoming. I've kind of adapted this question with a similar philosophy. Why do you think it's crucial for these companies to not only define its identity, but to ensure that every action, decision, strategy aligns with that identity to optimize themselves for success?
So for me, it comes down to authenticity. And we talked a bit before about overclaiming. And not only do you not want to overclaim because you'll get into trouble and there are dire consequences to that, potentially, not for everyone, but there are in some cases. But the other part is that if you're saying things that you can't back up and that aren't true, people won't trust you, and that isn't going to feel authentic to you as an organization. And so I think that having a big vision and having values is so important because it gives you a North Star to shoot from. So the vision gives you that North Star, but your values give you a framework by which what feels right. So whether it's making decisions or whether it's about figuring out the way that you communicate in the way that feels most appropriate and in line with who you are as an organization and what you stand for. People generally aren't in healthcare to get rich and if you are, you're in the wrong space, and definitely not to get rich quick. It is a really slow space, but it's rewarding. It is driven by purpose. And I think that therefore, by and large, people actually have a really strong sense of their values and the difference that they want to make. And I think that gives you such a strong compass when something just doesn't feel quite right. I know it has for us, and lots of decisions we've made are really tough decisions, and talking to many other founders as well, that sometimes you just have this that doesn't feel quite right. And when you give yourself the opportunity to reflect on it and you think about, okay, well, what are my values or our values and how does this correlate to that? Don't try and be something that you're not. And don't try and create and the illusion that your organization is or can do something that it can't, because you'll get found out really quickly. And ultimately, I think that has huge commercial impact pretty quickly, but definitely in the long term. And it's really easy to name names, but let's come back to that telehealth company that we talked about earlier. We're seeing some of the consequences of that now. And that's not to say they didn't do great work, because they did do some really fantastic things and really paved the way in health tech, innovating and rolling out a carpet, I think, for lots of other health tech companies that have come since to innovate and change and bulldoze down some of those barriers that really were in the way. But I think if you're not authentic to who you are as an organization and what you stand for, it's not going to set you up for success, in my view, and on any level.
And this way of demonstrating authenticity, you do this by providing value, right? In the form of content in this new digital era. You want to, the only way that you're going to express your authenticity is by having a value-led approach going forward that demonstrates this authenticity. And I was listening to a podcast Ali Abdul did, the YouTuber, and he talks a little bit about setting yourself up for success is by having this value-led approach where 80% of the content you're producing is just providing value, and then if you have something to sell, then the other 20% you can try and sell your stuff, but always focus on primarily pushing that 80% of value and demonstrating your authenticity, because then people are really going to resonate with you or your company, and then are going to be more inclined to then buy the 20% that you're also pushing. So talk to me a little bit about this, specifically this healthcare space. How can a company demonstrate that they're authentic through this value-led approach?
I think it's super interesting, and it's a principle that is really fundamental to everything that we do, whether that's with clients or anything we do as an organization for the community and for the space. And I think that, again, selling in healthcare always feels a bit icky. And that's not to do a disservice to people who work in sales in healthcare, because I think you have a really hard job, particularly when you're selling to the NHS. And again, it's a space that is driven by purpose. It's new and lots of people are learning. And I personally really believe that you get back what you put out into the world. And I think that a rising tide lifts all ships, all number of cliches here. I'm running with it. But I think that everyone is going to benefit when we all pull together and we all run in the same direction. And as I said, with our clients, it's quite an education to convince them that actually you're going to get a better result if you figure out how you can deliver value and stop trying to sell through your social channels. The website's a bit different, but through anything you can. An event is a great opportunity to do that. What do you have that other people need and can benefit from? And there's always this balance, because ultimately you can't be so giving to a commercial detriment. Otherwise, you're going to run out of money and have no customers, but you're going to feel really good because you've done loads of nice things for people. You do have to get that balance right, but it's a very much the sentiment behind our SomX Health Tech Talks that we do in partnership with Google Cloud. Those are free to attend, ticketed events, and we love bringing together the community to network. And again, network feels a bit icky. It's actually just bringing together loads of great people to have great conversations, and people have got investment, they've got jobs, they found their co-founder, they've forged partnerships and collaborations and changed career paths entirely. And we bring together experts and have really honest conversations with them to ask the hard questions and the things that you really want to ask them. And of course, there's some downstream benefits. Perhaps people will come back to us maybe if they do want some communication support further down the line. But ultimately, that is about delivering value to the community. But we can't only do that, because otherwise we're not going to make any money. So I think about what you have, the knowledge that you have, the expertise that you have, that you can give to. It doesn't have to be a community at large. It could be a very specific group of people, and it could be a specific cohort of your customers or target customers, for example. But the point is, when you deliver value to them, they're going to build trust in you and they're going to engage with you more. And when they need what you have, they're more likely to come back to you. And that can be even through the content you put out. Big industry reports, make it easy for people, summarize it, give them the TLDR so they don't need to read the whole thing, but they've understood what's in it. Or they know, actually, that's relevant for me, I need to go and read the whole thing. So think about that. Is it that you can break down the latest science behind RNA techniques? Maybe that's what your value is. And so your entire value add is that you make that science really accessible for people. And maybe that is attracting people from other industries outside the traditional spaces into biotech and life sciences and deep science. Maybe that's what it is. It depends on who you are and as individuals and as an organization. But I think the value first principle is such an important one. And I think given time, you will definitely see an impact. What I will say is it definitely doesn't replace a sales strategy. You're not going to get inbound from value first content. What you are going to get is relationships, and then down the line you're going to get that inbound. But also what it will do, it will nurture your pipeline, it will nurture your sales funnel, because people will know you, recognize you, and trust you because they've already had an interaction with you and received value and received benefit. So that would be why I recommend values first.
And this value-led approach, and in specifically the world of content creation, there's three things that is always repeated, which is first to inspire, second to educate, and third thing is to entertain, right? The first two come quite naturally, I think, to academics and health professionals. We've grown up educating, right? Whether it is educating patients, our peers, in a solely academic profession, we have to learn and then teach. And then through that, inspiring also somewhat comes naturally to academics. But the third thing, entertaining, I would say is difficult to get right. And so talk a little bit about, in this value-led approach, how you can also entertain.
It's not necessarily a difficult one to get right. And it doesn't necessarily mean that you need to put on a comedy show across your LinkedIn feed.
Although some doctors do that and they're doing pretty well.
They do. But I think there's so much nuance to it. And I think if I take the example of HealthTech Pigeon, so that is a funny newsletter that goes out every single week that summarizes the health tech news in brief. Now, we all as individuals have blind spots. And the thing is with being funny, it's very easy to stray into a space where someone might be insulted. And we have a really strong belief internally that there's multiple people who review Pigeon, and if one single person feels even slightly uncomfortable, it comes out or it gets changed, because if one of us feels like that, someone else will too. And the thing is, it's not perfect. We still, amongst us, are going to have blind spots. Things will slip through. I think the entertaining thing, I actually don't necessarily know the answer to it. And in part, it will come down to your brand and what feels authentic to your brand, because some brands having some kind of entertaining edge is not going to be appropriate. But I think you can still, something that's inspiring and educational can still be entertaining if it's created in the right way. So you could, for example, create a really entertaining animation, as I said, about RNA and what it is, or RNA vaccines and where they came from. That could be really entertaining. It doesn't necessarily have to be funny. So sometimes the art of entertaining is actually in the creative. And I think you'd be surprised the creativity that you have in your teams amongst traditionally what you would consider to maybe be technical or academic expertise. Some of the best creative ideas I've heard from have come from engineers, for example. I know an engineer who's also a beekeeper and a DJ and is one of the most interesting creative people I know. And so I think, look within your teams, don't necessarily feel like, as I said, you have to put on a comedy show, but think about what is creative and entertaining to, firstly, you as an organization, but then people outside of your organization. I think as long as you're doing that, those first two, it's just about creative execution, really, I think, is in the end entertainment piece.
Yeah. The health tech pigeon does do it perfectly, where you're educating, you're inspiring, and you're entertaining. And it recently just hit 4,000 subscribers. So big congratulations. I'll be leaving the link.
Thanks.
I'll be leaving the link to in the description for anyone that hasn't subscribed yet. I highly doubt if anyone's listening to this, you haven't subscribed, because it's pretty much a staple in the health tech community. But what you've been able to do amongst using this value-led approach, you've also fostered a community around it, right? And this is something SomX has done and has pioneered the way around creating almost a movement in the health tech space, whether it is through the pigeon or James's podcast, or also your events, which are stupidly oversubscribed. And I know I told you last time that I'm expecting an invite to the next one. So I guess the question is, what is the secret around pioneering this movement? Was it strategic to begin with? What is the secret around fostering a community?
Funnily enough, I think it comes back to value and values. And some of what we've done has been by design, and some of it has just been because it's been fun and we've wanted to do it. And so let's see where it goes. But again, I think it's about finding your people. For example, James set up the podcast because he wanted to be able to have conversations with people in a way that delivered value. We all, and everyone I know, gets an inbox full on LinkedIn of, hey, if we've coffee, can I have a chat? And that's fine. But actually, what's a way of doing that where everyone gets to benefit, rather than someone having a conversation with someone and then being like, okay, maybe that'll pay back to me eventually, or did I just waste my time? And don't get me wrong, by and large, we speak to really awesome people and it's never a waste of time. But that was a really great way of creating value for the person who he was having that conversation with. And I think the events really, again, we just wanted to create a space for people to hang out. And again, as I said, ask the questions that you've always wanted to ask people in a way that lots of other events don't. You have the same conversations, that kind of the same people on stage, and talk about the stuff that's interesting and relevant and trending at the time. So I think creating community you don't have to necessarily even create a huge community. Community can be quite a small thing, but I think it's about reciprocal value, offering out something that you can do for people or a group of people, but creating a space where other people can contribute to. And again, as I said, that can be through events, that could be through WhatsApp groups. I remember so many awesome WhatsApp communities where, it's not one person leading it. There are, of course, leaders, but it's ultimately like such a multifaceted conversation and people offering up opportunities and perspectives all the time. So often people will have a problem or something's happened and they just want to get a second opinion. And then they'll get such a diverse range of perspectives. And that's an awesome way to create community. And so maybe a good way to create community is identify a problem you have and create community around that. Because if you're a person with that problem, other people will have it too. But I think also same principles apply to what we talked about before in terms of creating content and taking a value-led approach. But again, don't let that be your main focus. Otherwise, it can become a distraction from your commercial goals. And ultimately, that has to take priority too. But the two can definitely complement each other and run in parallel. They don't have to be at odds with each other. It doesn't have to be one or the other.
Yeah, it's really great advice. In this new digital world, creating a movement and building a movement around you and your company is super important, because you need to have people behind you, right? So what other actionable steps would you say have emulated the success that you've achieved with SomX in creating this movement as well? You mentioned earlier some partnerships and how you partnered with Google Cloud, so maybe you can talk a little bit about that as well.
Yeah, I actually think that partnerships are not necessarily underrated, but I love a cliche, and they say that if you want to go fast, go alone. If you want to go far, go together. And I think building partnerships based on a shared destination, a shared vision, shared values, you'll find so quickly, particularly in this space, that there are people who do have lots of shared values with you. And even if it's a single shared value that you together want to build something on, that's a really great place to start. And ultimately, you're both going to be bringing different things to that. And we've been so fortunate in our partnership with Google and many others like it, that it's always been, what can we do together, rather than I'm doing this thing, how can you help me? It's never been that. It's always been so collaborative. And we've always had this shared vision for what we're setting out to achieve and what we want to do. And so I think, yeah, whether it's a community or whatever it might be, don't necessarily feel that you have to do it on your own. Don't be afraid to ask for help. And I would also recommend just say yes to things. So we were actually approached by Google and we didn't really know what it was about, but of course you don't say no to Google when they asked for a chat, and they were interested in collaborating. But equally, there are partners of a similar ilk that we've turned down because we don't have shared values with them. So I think it is really important to have that fundamental understanding, because otherwise someone is going to feel like they're getting the raw end of the stick. I don't think you'll end up either one of you getting the best out of it. But it doesn't have to be a big partnership. I really see such impact with much smaller companies collaborating together that all care about something similar, or even maybe they've been doing similar things. They've been running similar events maybe and collaborating actually to do something bigger that creates even greater value. So I think you can share resources, share thinking, share brain power. And at a time like now, I think shared brain power is important. We're all doing a lot and trying to achieve a lot.
So what's next for SomX? Newsletters, podcasts, events? What is next in this value-led approach going forward? So you have an event coming up, is that correct? On the 12th of September, I want to say?
11th of September. I will send you the link right after this. I know you've wrapped mine up before. I will get it to you. So what is next? So I have enjoyed quite a quiet August, thankfully, because event season was a bit chaotic before heading into another very busy season towards the end of the year with lots and lots of really awesome events and collaborations, might I add. So you're absolutely right. We have a whole host of stuff going on, not least our next event with Google, which is on the promise of AI in biotech. We will definitely be talking about LLMs, ChatGPT, MedPalm, all of that stuff that people are dying to know about. So I guess that in the short term. And what we're looking to do is establish a much broader series of events. So for the last few months, we've been looking at how do we take our focus outside of London. We've been very London centric with the events that we've been running. So actually, how do we take that out to different regions and make sure that we're not, I guess, being exclusive in that way? We want to be inclusive. We want to bring in people, perspectives, and companies where, let's be honest, traveling to London's a ball ache, and I only live like half an hour outside. And so it's annoying if you're in Scotland, if you're in, I don't know, Yorkshire. I traveled to Sheffield the other day for a personal thing, and that was graft. It was annoying. So yeah, it's tapping into those communities and better supporting those. So thinking about how do we do that, and particularly thinking about how do we create value and create opportunities for underrepresented founders and underrepresented communities. And I guess not gatekeeping our network and the opportunities that we have to make sure that there is equity of access, not just for patients and the care that they receive, but also for the people who are doing really amazing things to make a real difference. So there's that. We have our sights set on a big health tech party. So doing a huge event, like a conference, but not a conference. Really fun, more of a festival vibe. I think that will be at least towards the end of next year, maybe even 2025. I've got personally, James is involved too, a big event that I am currently project managing, which is our wedding. So I need to get that one over the line first, and then we can think about a big SomX event, or maybe both are the same thing. Who knows? Watch this space. There may be wedding invitations coming to the health tech community yet. And from a newsletter perspective, I'm not thinking about this hot for the press. We are doubling down into biotech, creating a newsletter specific for biotech companies, all about the raises, acquisitions, the science. And you heard it here first, it's Biotech Dodo. So watch out for that one. And all the merch that will invariably be coming with it.
Very exciting. Health Tech Pigeon and Biotech Dodo. Can't wait for that. Jess, it has been my pleasure having you on the podcast. Thank you so much for coming on.